So at Dr. Newman's clinic, we use mainly two treatments. We use a treatment called thermocoagulation, another treatment called injection microsclerotherapy. So thermocoagulation uses fine bursts of heat that last about 0.2 of a second to stick veins closed. We use this predominantly on the face, but we do use it in other areas, upper arms, upper chest area. Injection microsclerotherapy involves inserting a very fine needle just beneath the skin surface and injecting a solution, irritate the inner wall of veins to stick them closed. So the thermocoagulation uses fine bursts of heat of 0.2 of a second, using a fine filament that's placed immediately over the vein. So this coagulates or causes the inner wall of the vein to become sticky or heated up and sticky, and it sticks it closed. So literally, as you cauterize along the vein, you see the vein stuck closed before your eyes. Over the next 2 to 3 days, the redness fades, and over the next 3 or 4 days following that, the body then absorbs the redundant vein wall. With injection microsclerotherapy, the injection solution irritates the inner wall of the vein, causing an inflammatory reaction, causing what we describe as being sticky in the medical sense. We then put pressure on for the next 2 to 3 days in order to stick that vein closed. And over the next 2 or 3 weeks following treatment, the body then absorbs the redundant vein wall and the vein disappears. So thread vein treatment is really safe. It's a very low risk procedure. With thermocoagulation, patients see some mild redness for 2 to 3 days following treatment. Occasionally they can see some fine indentations along the line of the vein that's been treated, which fades over several weeks. With injection microsclerotherapy, it's a very safe solution that we use. We use a 20% saline or sodium chloride solution, which is very natural. It's largely what the body's made of. Our cells are composed of a 0.9% sodium chloride solution. So there's a zero chance of an allergic reaction. So both treatments are very safe. So some patients require initially just one course of treatment, which on the face may be 2 or 3 sessions, on the legs maybe 3 or 4 sessions. And for some patients, the treatment is curative and they know they don't need any further treatment at all throughout the rest of their life. Other patients come back once they see further veins forming, which can be a year or more following the initial treatment. A lot of whether a patient needs to return to the clinic depends on the cause of their veins. So some patients have underlying skin conditions that cause veins to accumulate. But whilst we can treat what they have at the moment and clear veins at present, it's difficult to prevent further veins from coming. So the story is different for patients depending on whether they have any underlying skin issues. Following thermocoagulation, patients will see an instant improvement, and often they'll go and look in the mirror and say, gosh, look, my veins have disappeared straight away. So results can be immediate. There is some background redness, some mild background redness, which often looks a little bit like sunburn. And that can take 2 to 3 days typically to settle, sometimes a little longer, up to a week or so. And in unusual circumstances, even a little longer than that. But the downtime is really quite short. In terms of with microsclerotherapy on the legs, patients will have compression. They'll have little pads taped to their legs over the veins that have been treated. This is to compress the veins and help them to stick closed. Once the pads are removed after 2 or 3 days, the patient may have bruises along the line of the vein that's been treated. And this fades over a week or 10 days. Patients can take, it can take patients 2 or 3 weeks to see the effect of microsclerotherapy of thread veins on the legs. And this is because the body absorbs the redundant vein during that period. So immediately following treatment, we advise patients to keep the area of treatment clean and dry. We advise them not to apply any makeup for 24 hours. We advise them not to get sunburned, certainly in the immediate period during that 2 or 3 days following treatment. In the longer term, patients that have underlying skin conditions, we recommend that they do all they can to control those background skin conditions. And we offer advice for the common skin conditions such as rosacea, eczema, seborrheic dermatitis. We know that controlling background skin conditions, controlling that inflammatory component, reduces the rate of further vein formation. In terms of, we offer general advice about ultraviolet light exposure. You're no more at risk of the effects of ultraviolet light following treatment, but it's considered to be good practice for all clinics treating skin to offer advice about reducing or minimizing ultraviolet light exposure.